The issue is that we don't necessarily have a reporting problem in this country in terms of these violent incidences. We have a coordination problem. How many attacks have we heard about where the attacker was known to the school as being a problem, or was getting mental health, or had been notified or had been recommended for mental health, run-ins with the law, things like that? Almost all of them have a history of interacting with those sectors in some capacity where they were very clearly on the radar but hadn't gone over that threshold. And so they were just left to sort of fester there within the system. And that is really where the giant gap in prevention is it's not that we don't know where these people are coming from. It's that we're not coordinating amongst ourselves to get them the assistance that they need in a timely manner.
Hey friends, welcome to Public Health Careers. I'm Omari Richins, founder of the Public Health Millennial. Every other week, I interview leaders and practitioners across public health, sharing their expertise, lived experiences, and the strategies that can move you and your career forward. Today's guest is Robert Mahoney. Robert is founder and CEO of TVTP Solutions. He leads prevention-focused strategies to address targeted violence, extremism, and community safety. With decades of experience across FEMA, Homeland Security, and the State Department, he bridges public health and national security to build human-centered, community-rooted solutions. He conferred a Bachelor's of English at SUNY Buffalo, followed by a Master's in Emergency and Disaster Management from Metropolitan College of New York. In today's episode, you'll hear and learn more about what targeted violence is, why there are no random acts of violence, how the path to radicalization of an individual involves emotional and psychological factors, how isolation is a key indicator of potential violence, why prevention strategies must address the unique narratives of the individual, and behavioral threat assessments are crucial for prevention work, why coordination among sectors is essential for effective prevention, while also using human-centered approaches can greatly improve security measures, and much, much more. Be sure to hit that subscribe button and enjoy today's episode.
I'm Rob Mahoney, founder of TVTP Solutions, and you're listening to Public Health Careers.
Hey, Robert. Very, very glad for you to join us today and to dive a little bit more into your journey. I don't think I've interviewed many people with your type of background and the work. I think it's fascinating.
Well, it's a pleasure to be here, and thank you for looking sort of outside the box and inviting me. Hopefully it'll pay dividends.
It absolutely will. I feel like there's so many paths and ways to do meaningful work to amplify public health work. So appreciate you joining us and looking forward to diving in. So how do you identify and tell us a little about your personal background?
So personal background, so I have a master's degree in emergency and disaster management. I started that career shortly after Hurricane Katrina happened and mostly focused on sort of mitigating, preparing for, and responding to sort of natural disasters. As I got sort of moving up the chain from sort of local and working with state and federal and all that from sort of a natural disaster side, I started beginning to sort of see, as we've all seen, sort of like this massive escalation with targeted violence, and started to take some of the skill sets that I got from sort of coordinating with different state entities and things like that, and moving it into sort of this targeted violence space. And one of the more glaring holes that I saw within the space was a few, but the biggest one was sort of a lack of weight or value that was being given to prevention methodologies and strategies. That most of the focus around targeted violence was more in what I would classify as more sort of protection-based methodologies, and then preparedness/response, which sort of makes sense. When we feel unsafe, we kind of check the locks. We want to add more cameras. We want to put more security guards or officers sort of on site, et cetera, et cetera. And then obviously, God forbid something happens, we want to make sure that we can respond to it as quickly and as effectively as possible. The problem that I saw with having that sort of mindset is that it's very defensive in nature. It puts you really in a defensive posture where you are almost inviting something to happen and hoping that what the blocks and the measures that you've taken will do the job efficiently. That becomes a really risky gamble on something that, granted, is low probability, but is certainly very high consequence. And what I began to notice was a lot of resources that were available within the prevention space, but untapped. I set this business up to really tackle that undervalued space of prevention. And sort of, as we probably will progress through in our conversation, understanding how people become not just radicalized, but radicalized to the point where they're going down a pathway of violence, and considering that is a very sort of step-by-step technical process that sort of has gone by sort of the wayside. The coordination between different entities, whether it be education sector or the mental health and public health sector, and law enforcement, as well as just sort of the general public, your different community groups and initiatives and things like that, them not really working together, and in some cases working almost against each other for the same purpose, and educating people on that to really dispel this sort of myth of what you hear a lot of, sort of random acts of violence. And one of my big pitches is that should be eliminated from the lexicon entirely, because if we are trying to be more on the offensive and more proactive in sort of stopping these attacks from happening, we need to change our framework away from sort of this random, we're just sort of in the worst lottery bingo game of life. And if, number 672 all of a sudden pops up, that, oh, too bad, you just get a shooting. We'll just see how it goes, right? It's not, when you understand how I'm going to probably explain later, the pathway of violence, you start to see like, oh, no, this is definitely a major gap in just the way the system is designed, and we can be a lot more proactive, and that there's really nothing random about these attacks at all.
Okay, so
I know it's a lot.
No, just so that everyone is on the same page, can you firstly explain like what is targeted violence?
Okay, so targeted violence is violence that is committed by an individual because of a motivator of a grievance, whether it be race-related, government, religious, anything like that, to sort of push a certain narrative, and things like that. Terrorism is slightly different in that targeted violence might not always have a message necessarily that's clearly behind it. That might be a little bit, with the definition that I gave, it might be just a little bit tricky, because it is sort of, it kind of goes back and forth, which is why when I started the company, I did both targeted violence and terrorism, because I believe it's all terrorism is targeted violence, not all targeted violence is terrorism. And because of the different motivating factors and the different reasons why the violence is committed in the first place.
Okay, thank you. That definitely helps ground us as we move forward. And I think a lot of the things you're sharing around, like why you started your business, you're seeing this gap in this prevention work, and you're seeing that there are ways that are, I guess there's a need there that is not being met, and you are going to meet it. And in doing that, you're going to help a lot of people. So you kind of alluded to radicalization, or what is the path to radicalization? Is that different from the path of violence? Can you explain both of those?
Sure. So one of the things that I think, especially people within the public health sector, you'll start talking about things like risk factors and indicators. And one of the things within radicalization that we have, within sort of my very niche industry, has started to pull away from, is looking at risk factors as being predictive in nature. You can have a lot of risk factors and check off those boxes, but your life kind of continues in a very peaceful way. It's sort of the same with radicalization. you can be radicalized to a point where you get red in the face, you alienate others when you start talking about something or everything else, but the individual doesn't believe that violence is necessarily the key to solving that grievance, right? And so when we make those sort of distinctions between how somebody becomes radicalized, it's important to sort of have that sort of framing. As we move deeper into how people become radicalized, it's more than just a grievance. It's really a character arc that is sort of shown through thousands, if not hundreds of thousands, if not millions of different events within that individual's life. Most of those are emotional and psychological happenings, right? So perceived slights, perceived injustices all play a part into it. And I think that's really important as well, is that we have really tried to create logical solutions to individuals who are highly unlogical, right? It is not logical for somebody to think that shooting 7 people at a church or in a grocery store is somehow going to solve a larger societal problem, right? So you're looking at the emotion that comes through with radicalization. And radicalization kind of wraps it around itself around 3 what I kind of call buckets. There's an identity bucket, there's a purpose bucket, and there's a community bucket. And all of us go through the world trying to find fillers for that bucket. Okay. And radicalization really takes hold not so much on the message, which is what we typically hear in the media or even amongst our friends and peers when we start talking about the latest attack or the escalation of rhetoric and things like that. We look at certain groups, or we look at a certain political bias, or we look at a host of other different things, movements or groups and things like that, that we believe this person is attaching themselves to, that it's the message that is resonating with them. In actuality, it's not the message. It's not always the message. For some individuals are looking for that specific message, they find it. What really comes across that really is the connecting factor are the intangibles like identity, purpose, and community that comes with the message, right? So you have to imagine yourself sort of afloat out at sea, and the human brain is incapable of accepting not knowing who you are. And so in the absence of an identity, you have to go searching for it. And many people, will latch on because it gives them, this is where the other 2 factors come in of purpose and community. If you are a plumber, you identify as a plumber, and no matter what happens, those skills sort of stay with you. If all of a sudden you retire after 35 years and you're no longer going out doing plumbing work, then what are you, right? And so you get this shock, this identity shock, and your purpose has gone away. And maybe all the friends at your plumbing company and all the other fellow plumbers and clients that you've had have all kind of gone away because now you're retired. Now your community is sapped from you, right? And so you go searching for a new identity or a new purpose or a new community. And sometimes those other things can give you the other 2, if that makes sense. So if you can find a community and they're all playing pickleball, and then you just, all right, well, I like these people and they seem to like me. And, my purpose now will be to wake up and go to this group and I'll play pickleball. And then all of a sudden I'm going to identify as a pickleballer, right? And that's really kind of how it works. And the more these individuals who are sort of lost latch on to something that gives them those things, the harder it is for them to unlatch off of it. And what you'll hear sometimes, a lot of people will talk to me about, like, well, how do you get them to they know what they're doing is wrong. How do you get them to divert their trajectory? And it's really hard to envision that. But if you're looking at it from everything that this group or this message or this movement or anything else is giving me, they're giving me an identity. I'm going online. I've got, a couple thousand followers on my social media, or I'm talking to them on different platforms. And then our purpose is, to further the movement or something like that. Why would you leap? You can see how hard that would be to just sort of leap back to zero and try to find something again. And so I think, though, when we talk about, like, how does somebody become radicalized, that's kind of how it goes. You get people who have a bunch of different sort of leading up events of a character arc, and then they sort of reach a precipice, and they've either found an identity or they haven't, or they have a community or they don't, or something happens that sort of breaks that apart for that person, and they go into sort of this sort of, as the Australians would call it, sort of like your walkabout, right? Like you go out and you just start searching for something or anything. And that's where you sort of see the non-logical, more emotional types things, where we will look at somebody post-attack and see that they were on the farthest of lefts, but also on the farthest of rights, and they believed in this movement, but not entirely. And then they had this movement, and they're like, wow, how do we connect these dots? And it doesn't have to. It doesn't have to. It just has to fill the bucket of the identity, community, or purpose for them to sort of absorb it and then create their own narrative, reality narrative on what that is. And so that's really, the nuts and bolts of how radicalization kind of takes hold.
Yeah, a lot of things you say in there is resonating with, I feel like, evolving world that we see out there. And I think, like, especially how hard it is, like, when someone is in an in group and you're in an out group, and you're trying to convince that, even if they know, like, as you're saying, like, the in group is bad, or they're doing things, they have that community, they have that purpose, that is so hard for someone that is not part of that group to kind of, like, have that conversation. So what because not everyone, maybe, like, a lot of people are getting radicalized. What takes someone from, like, radicalization to, like, violence? Or
So radicalization to violence is sort of it is as equally a long process. Okay, so you look at sort of radicalizing towards violence, that's going to take years. Okay, that's not something that somebody will see something on the news and to go, okay, like, from 0 to 60, right? Like, nobody does that. There's a very visible buildup that goes to the point where there's violence. And that's why behavioral threat assessment, which is a very popular tool now, and is something that is being pushed in a lot of different states at a lot of different levels, is a better predictor than, say, just sort of your escalation of rhetoric. The behaviors are, like I said, you can be radicalized but not believe that violence is really going to solve anything. So you're just kind of popping off for attention or blow off steam or something like that. When those blowing off of steams end up becoming sort of pathologically fixated, where it's the only topic that you ever talk about, when it's the only thing that you search for online, it is the only community that you talk to, you leave family, you leave friends, you sort of pull back from society, you begin to sort of hang out around certain spaces in a suspicious manner, or you begin to sort of broadcast violent intent. These are, or just have those sort of one-off comments that are of violent nature, or you're talking about past attackers and in your admiration for what they did and things like that. These are all behavioral things that, as seen with a character arc, is something that from a behavioral threat assessment you would go in. There is a second part to the behavioral threat assessment. They're usually called BTAMs, so BAT for behavioral threat assessment, and then there's an M, which is often not as explored. A lot of people love to do the assessment. They don't like to do the management, right? And the management is a very particular special skill set of how you approach the individual, what your management structure is going to be, not just for the foreseeable couple of weeks or months, but literally for years. That management is another sort of pitfall within the prevention space. So there's kind of like the overall giant hole of prevention that is a major gap, and then within that gap is sort of like a management gap itself. There's multiple layers here, but that's sort of where I target most of my focus, is really talking about understanding the behaviors. So isolation being sort of like the biggest indicator of potential need. Let's say that, right? Once we start getting into the purchasing of weapons or broadcasting in a more general sense, then you're sort of in that response sort of phase. But that's sort of the big one.
Thank you. And then in your work, you talk a lot about prevention-driven, human-centered approaches to violence. What does that mean in practice?
So the human-centric is understanding that everybody's narrative story and their character arc is unique to just them. And so the inability sometime of certain security measures to go to the median, right? For, let's say, 98% of the population, your security measures are going to be just fine. But you're already talking about people who are on the outliers already, right? And so you need to have a very different approach in how you identify those people and how you secure your space for those people. I want to make, just like for clarity purposes, I kind of break up the security fields in sort of like prevention, protection, preparedness, and response, right? All of those are interconnected and interdependent. If there's a drop in one, your security is massively dipped down. So it's not to say that things like, bulletproof glass or more security cameras or even more guards or, reinforced doors and all those sort of things, as well as sort of the active shooter drills and the head down drills and all those other types of things, don't have its place and don't have its value. My sort of mission is to show how overweight we are and how defensive we are in those things, and that if we wanted to be more proactive, these are types of, you need to have that third pillar of prevention there in order to have a really robust security system. To have a robust prevention portion, you need to think about the human brain and how the human brain works and the emotions that come behind it and things like that. For example, understanding that when we're doing prevention, we're trying to look for the human, like the complexity of the human and how they're reacting. A number of universities have these sort of blue call towers, right, all scattered all around campuses. And if you have a problem, you can run to the phone and you get somebody at campus security, and they will, on your tour, they'll tell you, their response time to get to you and everything else. Cool. Most students now, if not all, have a smartphone, and colleges have designed apps that go on the phone where you can live text a security professional. You can say, hey, there's somebody hanging around this hall or this way. You can be geolocated. Universities and colleges have even allowed their students to upload their class schedule. So if you needed to make sort of like a silent alert, but you were on the third floor down the hall around a corner at room 327 or something like that, your call wouldn't just come in from that building. It would come in and they would say, like, ideally you're going to be, on a normal day, you're going to be at room 327. So they know where the thing is. Light years in terms of effectiveness and more useful security terms, right? So a lot of the universities decide, well, this giant ugly tower is pretty obsolete now because all of our students pretty much have smartphones. So let's take them out. So they started to try to yank these things out. And the student population in almost every single university went absolutely crazy in that these were a visible, tangible sign that the university was taking security safely, even though they had something in their pocket that was wildly better. That is a human-centric sort of understanding of security and of prevention that often goes missed or just doesn't get the level of consideration that it needs, right? Why would people care so much about taking these obsolete items out when they have something that's so much logically better in their pocket? And so we really try to focus our attention on really understanding, as I mentioned, how radicalization works, how those individuals go down the pathway of violence, why you're trying to focus more on the behaviors of that individual rather than what that individual is simply just saying, but also having a structure for sort of early prevention, strategies and methodologies. How do you get even farther to the left to take those sort of innocuous life events and sort of give them attention? Because the breakup of a girlfriend or the death of a grandfather or even the loss of a job or something like that isn't necessarily something that is going to go to like a threat assessment team, right? Those aren't sort of things that are given to a threat assessment team. But those are things that, if left sort of untreated, can certainly enhance the spiral downward, right? And those, how do we get into that realm of sort of a culture of care, or a concept of care around individuals that are sort of, having these one-off sort of incidences, so that they know that there are people out there that care about them.
And what are some of the biggest challenges that you see when trying to unify the different sectors under a prevention strategy?
So there's a few. The biggest one is just the way these sectors are just designed, to be quite honest. They are designed to be sort of very targeted and specific in their nature. They have a very defined sort of lane that they are looking at sort of perfecting. And there isn't a lot of room for coordination. And so what ends up happening is that those systems are sort of called once a threshold is crossed. And so you are already on the defensive and in a reactionary posture. And you're also behind the eight ball because you're probably getting this as a shock to sort of your system. So I'll give you sort of a hypothetical scenario, but it'll show how all the different sectors sort of lack of communication. So if there's an individual at the school, typically the school will try to do things in-house, right? They'll have either a school counselor, or maybe they have a contract, or they'll just have their own disciplinary code that they sort of follow. But there's not a lot of outside coordination from what I've seen in reaching out to different social groups or boys and girls clubs or things like that, and making different types of connections, or trade schools or things like that. That individual that has having the school problems might also have a record or has been recommended for mental health, or is getting some type of public assistance and things like that in their life. If the school were to call mental health and say, hey, I have somebody, what would the first sort of question be? Is this person a threat to themselves or of anybody else? And the school would be like, well, no, not yet, but we're worried about them. And the mental health will be like, that's great. You can get to the back of the line. right? Because I have X amount of clinicians and I've got only so much bandwidth, and I deal with people that actually are crossing that threshold or have crossed that threshold, and I need their attention to be there, not somebody sort of like percolating on the side. You go to law enforcement, same sort of thing. Well, are they doing anything illegal? Well, no, not yet. Well, what do you want me to do? I'll scare them, say that if I have to come back here, I'm not going to be a happy camper, and maybe there's something that we can arrest him for, but other than that, what do you want me to do? And the concern within the community kind of grows and grows and grows, but who do you report it to? And if it's already been reported and they can't really do anything, where are you going with this? And so that is really one of the things that kind of came after 9/11 was sort of the see something, say something campaign. And I like the campaign from a marketing standpoint because it doesn't tell you what you're supposed to be seeing or who you're supposed to be saying it to, but we all kind of know, and we've now gotten into a culture, almost 25, 30 years later, where that's just become sort of the norm. The issue is that we don't necessarily have a reporting problem in this country in terms of sort of these violent incidences. We have a coordination problem, which is our problem. How many attacks have we heard about where the attacker was known to the school as being a problem, or was getting mental health, or had been notified or had been recommended for mental health? Run-ins with the law, things like that. Almost all of them have a history of interacting with those sectors in some capacity where they were very clearly on the radar but hadn't gone over that threshold. And so they were just left to sort of fester there within the system. And that is really where the giant gap in prevention is. It's not that we don't know where these people are coming from. It's that we're not coordinating amongst ourselves to get them the assistance that they need in a timely manner.
Yeah, that makes a lot of sense, and I could imagine a lot of people listening to this probably saying, "Yeah, the coordination among the big systems that we have here are not as effective as it could be," and to your point, they aren't the mechanisms in place to really be as supportive and work at a preventative and proactive level, which is really where we should be, but we aren't there just as yet. And I think it's important. This is like very cool and important and interesting work. So I'm glad to have you here. To shifting gears a little bit, wanted to ask, what does public health mean to you?
Well, public health to me is like that integration and interdependency. One of the things that sort of is hard to see, not being sort of like directly in sort of the public health sector, but seeing things sort of like, I worked with some states that their public health system had analytics where they could almost tell you if you were a first-time recipient of food stamps, they could tell you almost to the month, week, and day that you would show up for housing assistance, right? And they knew the X percentage of those people. And yet the lane for food assistance and the lane for housing assistance never merge and never cross. And so what I see with public health, and certainly with the individuals that I'm trying to target for assistance and things like that, is that the onus is almost on the person in crisis to navigate through the public health system to try and figure out what's over that hill of what crisis is going to be there, and then how do I prevent that from happening, instead of the system sort of taking hold of that individual and going, listen, we don't know if you're going to fall within 36% of people that are going to need housing assistance, but here's some stuff to get the ball rolling now. And I'm sure there are some public health entities out there, at the municipal and even state level that have, that are doing that or are trying to implement that in a really effective way. But it also has to be a little bit more globalized. And so I think integrating public health almost into all of the sectors that we have and making all of those different sectors interdependent is going to be in the future. Hopefully what I see is the next iteration of how we approach public health as a society.
Yeah, I would agree with that. And I definitely think there is a better way to envision the system in which we work and to create one that does support and be more proactive and have more of that prevention lens. So you're a professional working in targeted violence, but you weren't always there. So you got your bachelor's at SUNY Buffalo and then went on to get your master's in emergency and disaster management at Metropolitan College of New York. Can you walk us through the process of going into undergrad and then going into your master's program?
Yeah, sure. So went up to Buffalo because they actually had a great dental program at the time, and I thought that I wanted to be a dentist. And I quickly realized that my mental capacity for that was not there, and my passion wasn't really there either. And so I sort of bounced around to a bunch of different majors and things like that, and just ended up sort of graduating with a bachelor's in English. So being able to communicate, I guess, has served me well going forward. But really, the real defining event for me was watching Katrina in 2005 devastate New Orleans, and seeing the federal reaction to that, and seeing seemingly very basic things that sort of just the ball got dropped. One being that always kind of shocked me was when they were evacuating people out of the city, there was no plan for how these people with pets, how they could evacuate the pets. And that seemed like such a very specific but so obvious thing to me, of like, how does nobody in a giant agency like that think, like, there's no crazy cat ladies in FEMA? Like, there's no, like, my wife would, if there was a fire in this house, she would grab the dog before she grabbed me, right? So it was one of those things that just intrigued me from a problem solving sort of arena. And when I found the program at Metropolitan College, it was a brand new program, and the guy that was running it, Scott Phelps, he had a vision, but he didn't, like, it was still kind of coming together. But I got it, I graduated, and I've been working with local municipalities and states and even federal government entities and things like that on just how we communicate preparedness for a snowstorm or a flood or a hurricane, and all of that. And that began to sort of migrate into just working within, there was an overlap between sort of like that emergency management and that security sort of realm. And I just kind of, as more and more of these attacks kind of just became so prevalent and just almost routine, disgustingly enough, I just felt that there had to be a different approach. I thought, in the same way that, like, nobody thought about, evacuating pets, I thought, like, is there just something that we're not, like, nobody's considering? And that's how I kind of got into the violence prevention realm, and just started seeing, oh no, there's an actual scientific process by how, in a step-by-step pathway that these people go through, irregardless of what is motivating them. And if you can, there really isn't anything called random acts of violence. There's like a defined story arc, and if you can find a way to get plugged into that story arc, you might be able to maneuver them in a different direction and things like that. And so that just kind of snowballed from there, and started the company and started doing some consulting work and things like that for different entities, both in the public health sector, law enforcement sector, education sector, just about the philosophy around prevention, what to look out for, and then trying to bridge that coordination, just like I would do for disasters, of getting all these different government entities to sort of speak the same language and talk to each other and come up with different strategies on how to mitigate this and that, and just went over into that.
Yeah, I appreciate that. And I think the story of like the pets, like, just really centers or like talks about the human centeredness in this work and how important it is. And when you leave it out in your planning and how you think about situations, the ball gets dropped on those kind of things. And that's a very simple Yeah, that's a great story of how you got interested and involved in it. You also worked for FEMA for 11 years. I think you held roles as planning specialist and deputy director for the National Hurricane Program. What was that experience like? What were your biggest takeaways?
It was a fantastic experience. I got into FEMA sort of after FEMA had been, the morale at FEMA after Katrina was super low, but there were a lot of good people that sort of came in and tried to build it up. Some successes, some not so successful, unfortunately, and working with nature, that's sort of the way it goes. But the planning side of going and doing different types of plans, whether it was an earthquake plan or a hurricane plan or something like that, it was more of a people kind of business. It was the relationships that you build, the trust that you build, being able to reach out into the local communities and sort of talk to people, get their feedback of what they need, what they're worried about, things like that. And then one of the things with the National Hurricane Program, I came in right around the time where storm surge was being debated. And this goes sort of, I didn't realize it at the time, but now when I say, well, we need to push back on random acts of violence and how the communication goes between the public and myself in terms of getting them to prevent things and being more proactive. Storm surge was one of those things that from FEMA and the National Hurricane Center and Weather Service were debating, because there's a very scientific explanation about storm surge, but it is incredibly complicated and mathematical and scientific. And what some people at the Hurricane Center and NOAA and FEMA were kind of telling the old guard was, people just want to know how much water is that they're going to have to like step into, or how much water is going to be coming into their home, right? They don't care about the slope of the shoreline and how much wind and all this other stuff. They just want to know how much water's on the street. And so that, I see a lot of parallels sometimes with the public health sector in the same sort of way, where there's a lot of logical data that gets sort of put into a decision. And the people that are leading those agencies feel that sort of facts are going to lead the way. And in actuality, sometimes that just muddies the water, or it creates room for more debate. And if you can find a way to tap into more of the emotion, which is usually what we drive our behaviors off of, is more of a feeling rather than facts. I find that to be an interesting dichotomy between trying to communicate effectively, especially in the safety realm, whether it's water on the street or it's a school shooting or it's a flu outbreak or something like that, to what people hear, how people analyze and feel that, and then how they're going to dictate their behavior based upon what you say. So it's an interesting way of sort of getting your message across.
And you've worked at various levels of municipal government. What are some of the takeaways from that?
Well, it's you're dealing with a descended triangle of specificity, right?
Mm.
There are giant initiatives from the federal side that get slimmed down to the state, that get slimmed down even more and more and more until you actually have to get like an action going there. So understanding the complexities of each one of those sectors and the different parameters that they are working under is always really, really important. For my work, I'm pushing a concept and a philosophy, as well as some strategies and methodologies to these entities on how to bolster their prevention. While I don't think that it's a terribly difficult shift in focus, I have to be sensitive to the fact that if they shift to more of this, they may look at it as an either or. I try to present it as much as like, and you can do prevention work, and it doesn't really cost much of anything. And, it's more effective. But there are certain ways in which certain entities do business and how they are structured that sometimes, for lack of a better term, prevent them from doing as effective prevention as maybe they would like, right? That their lane has been very clearly defined, and any movement outside of that, even for the benefit of what they are doing, is just prohibited.
And then transitioning into your work at TVTP Solutions as CEO, what do you do like day to day, week to week? I don't think I asked you that earlier.
So most of it is doing it's doing podcasts. It's spreading the word of prevention. So it's working with reaching out to different groups and municipalities, different law enforcement entities and agencies and things like that, and talking about prevention, getting them sort of on board with wanting to do it. I think I kind of see it as a 3-step process. So you got to get people on the train first and get them jazzed up. Then once they're on there, I can kind of give them the overview of behavioral threat assessment. And this is where really the specificity comes in, where not every school operates the same way, and not every local SRO or school resource officer is part of the police department. Some of them are volunteers, or some of them are from a contracted company. And then, so you have to sort of maneuver around those sort of things and those types of relationships. But we give them the tools for, these are the things that we're looking out for. This is the type of culture that you want to cultivate within this. This is the type of reporting structure that you want to create, both internally from your school district and then externally to mental health professionals, law enforcement, other community groups, etc. And then the third part is kind of like your incredibly specific sort of management structure. So most clinicians in this country do not get formalized training in violent ideation management. It's usually a mishmash of substance abuse and suicidal ideation management techniques. There are some subtle and not so subtle differences, and there are some things within the violence management expertise that need to be done. So we give them we allow them to sort of figure out how deep they want to go. And then we use the specific environments that they are and operating environments that they're under to try and massage the best program that for them. So really it's working with gathering information on a day-to-day basis with the clients that I have, searching out for other clients, doing marketing work, et cetera, trying to get not just the message of prevention out there, but also giving them some tangible things that they can implement to make their environment much safer, whether it is something as big as a town or something as small as one particular school.
And if you're talking to someone that's like maybe just getting interested in prevention work, emergency management work, what kind of advice would you give them?
Wow, that's a good question. So I think if I were to start again, one of the things that I would need to really focus in on is exactly who my audience is. Like, what is my sector, and who within that sector am I communicating with? I say I've gone to a lot of different organizations and things like that. I've never encountered an audience that pushed back on me that said, like, this prevention stuff you're talking about, not really our thing, right? Like, I don't really see the usefulness of it. I don't really see the value. It's never that. It's more a case of, okay, I'm totally on board with this. How do I begin the process of doing it? And so for somebody who is trying to get into the violence prevention space, define your audience and then figure out for that specific audience, what is the leave behind that you can give them? right? What is the actionable items that you are trying to impart on them? Because philosophy and concepts and stuff like that is great, but if they believe in your philosophy and your concept, you're going to need to give them something, right? So that would be my advice for somebody to get in there is try to narrow down your audience as much as you can that you feel the most comfortable in talking with, and then provide them with those leave behinds of, and then if you liked what I said, this is how you can employ it in your environment.
And then in the next decade, what do you hope to see in terms of violence prevention?
In the next decade, I think whether we like it or not, I think we're going to be forced into just the reality of the fact that we need to focus a lot more on prevention. I have a video that I did on my YouTube page, which I'm sure we'll get to all the promos and stuff like that. There was a case out in, I believe it was in Ohio, where a man went down a very crowded sort of restaurant / bar street in Ohio and killed 9 people. I think from the first shot to the moment where he was put down, I think it was less than 27 seconds, I want to say. And that was with 6 officers that were sort of stationed on that road. I think we have to reframe it, especially in the next 10 years, of like, are we putting things in there to protect and prepare, or are we getting things to prevent? Because I see that incident and I find it really hard to think of a quicker response, right? I think just physically, it's just going to be hard to get faster than that on an unnoticed thing. When you look at the perpetrator who did that in Ohio, he had over a decade-long sort of rap sheet of different behavioral issues, different sectors that he had been passed, along to, including law enforcement and everything else, mental health. There was 10 years of lead up where that kind of intercession could have done and attention could have been done. That wasn't. And we focus so much on trying to narrow the gap between, for 30 seconds, right? And so I think in the next 10 years, I'm hoping that there is going to be a reframing and a reshifting of priorities, that we're not taking away from the preparedness. We're not taking away necessarily from the protection, maybe here and there a little bit, in the hopes that our prevention will rise up. The best analogy that I've kind of come up with to kind of describe it is sort of looking at a Michelin star restaurant, where if you were to rate a restaurant, there's really 3 categories that they focus in. It's sort of ambiance, service, and then the food. Those are all interdependent, right? So you can have fantastic food, but if the ambiance is, in a garage, and even if the service is fantastic, you can't tell the difference. In fact, I think there's an Austrian economist that said something that the human brain cannot differentiate between the person that cooks the food and the boy that sweeps the floor, right? Like, they all come as a package. And what I would like to see within the next 10 years is that package to sort of be elevated enough with the prevention and integrated enough that we become an indispensable pillar of like the overall security strategy.
Yeah, I appreciate that a lot. And I think about like any of these incidences, there's this big backlash or the big like visual on media, and people are always talking about it's either like, oh, let's get more guns to protect people. And like, to your point, there were people there to protect people. And the best case scenario was 30 seconds and 9 lives lost. What about, and that's probably like the best that we can do on that like protection front, but how can we invest in the prevention part of things so that these incidences don't happen, or there are ways to to catch those people before they become violent and do these types of things. And I think it's you gave a lot of good examples and good reframing on like the importance of prevention. And even though we are this very wealthy country that focuses a lot on like protection of things, the best that we can do sometimes is not going to help people unless we're being proactive on the front end and trying to build a system, I think, to do that, whether that's violence prevention, that's food systems, housing, I think is what we really do hope to achieve. And like a big focus of public health is like, how do we prevent the things from happening before they happen? I'm really glad that we got to talk today. I have two quick sections before we wrap up the podcast. So the past week guest question was, what's an important skill set that you have in your field?
An important skill set is curiosity of, I'm focused so much on the human-centric ways of prevention, curious to understand how, like, behavioral science is a huge curiosity to me. Why we do things irrationally, why, does logic most times not have any effect on our behavior, how behavior sort of manifests itself and works. Super interested in that. And also curiosity as to the breadth of how these strategies are so multidisciplinary, right? There's a lot of overlap in prevention from substance abuse and suicidal ideation and violent ideation. And I've specifically focused on sort of like the worst case scenario of violence. But a lot of, when we look at it from the prevention lens, a lot of those sort of one-off innocuous incidences often can lead to substance abuse, can often lead to suicidal ideation. In fact, a vast majority of the people that commit targeted acts of violence, have some type of suicidal ideation attached to them. And so my kind of focus is, kill three birds with one stone, right? If we have an effective prevention concept in place, we can find the people that, we can get to those people a lot faster on a lot of different social ills and not just narrow it down to like, well, this is the only strategy for violence. That's not what I want this to be. I have received feedback sometimes of people who are in a bunch of different trainings, and that they'll get their signs of substance abuse or signs of suicide, or and then I come in with there's signs of violence, and they're like, oh well, I heard you talk, and I thought that this indicator was something like that, but I didn't know if it was substance abuse or suicide or violence, so I decided I'll just wait and see if more indicators come. But by then the person had left or moved on to a different grade and things like that. And so really trying to get people to really be as proactive as possible on the front end, and not let any sort of incident go without really attention. It may not seem very important to you on the outside or in the grand scheme of things, but it is something, if you compound that with another and another and another, that then results in sort of a quickward downward spiral. So the more that people feel that there is a community around them that cares about them and that they can go to with issues, or that there is something there that is sort of like a safety net that they're going to crash into before anything gets sort of out of hand. Sort of like that example I said about the food stamps and the housing, right? Like, we don't know exactly yet, but there's a good enough percentage that we're going to try and be proactive and nip this in the butt just in case, right? And so I think that curiosity is the one thing that I would hammer home.
Yeah, thank you for that. And I think like the goal of having like an interconnected system is the goal, but until we have an interconnected system, I think to your point is like you have to take each of those interactions. So you have to really like understand that those interactions are not isolated within the one system that you're in. And understand that there might be ways that you can prevent something from happening because of whatever that interaction is happening. So I appreciate you lifting that up.
Yeah.
So shifting to the Furious Five, the five questions that I ask all guests, and you kind of answered the first one before, but let me know if you have anything to add to it. So number one, what advice would you give to a student trying to pursue a career in public health or violence prevention?
Uh, yeah, like I think the curiosity. I think public health is something that like it's omnipresent, and if you approach it from that perspective, I think the world's the old saying, the world's your oyster, right? There are so many things on a day-to-day basis that touch public health in hard and in soft ways. So there's so many different paths that are open to you. I'm not a public health specialist, and somehow I'm sort of on involved in public health and on the periphery and integrating with different public health entities and things like that. So even if you're not really in it, you're going to be in it in some capacity. So that would be my advice to people in the public health sector or looking to be in the public health sector.
Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
You got to be just diligent. I've gone through ups and downs of periods where I'm super busy and then periods where nobody really wants to talk to me. One of the things that I sort of tell myself, that I've done this for so long and I've seen people's reactions to it and things like that, that it's not the product.
Mm-hmm.
The problem is not with the product. It is all it's all them. Okay. It's just people's appetite for it. And in my position, the language that I use, I get the attention because it's targeted violence. People are intrigued. People are also scared, right? It's not something that in peacetime anybody wants to bring up. Nobody wants to bring that vibe into a room and talk about, a targeted violence attack and what do we do with it and what's our plan going to be. So, being sort of understanding that people want this product, the market just doesn't really know exactly how to handle it. There's nothing tangible in terms of data that you're going to say quantitatively that you're going to be a success at, which is also sort of a stumbling block when you're trying to sell it to people. People love to hear it. They don't know how to measure it. And my pushback to them, if somebody was in the private, in the prevention space, violence prevention space, is what's your ROI on all the cameras? Like, what's your ROI on all of the new officers that are roaming around now or anything like that? Like, how do you measure, just because something didn't happen, that's a success? Like, that's not a metric that people really can grab a hold of. So you have a really high dollar figure of how much money you've spent on all of these different things. There is no metric to sort of quantitate how much value you're getting out of it. And I would much rather be in a space where people feel more motivated internally and emotionally towards doing something, rather than sort of paying for something and hoping that something that is, let's face it, low probability but sort of high consequence of an ROI that is on those other things.
Number three, what's something you're working on improving in your life right now?
One of the things that I'm really, really interested in is safety design. So as you can see from my background, I'm a map of Rhode Island right there. So I have the luxury of being relatively close to RISD, the Rhode Island School of Design. And I have been in talks with them for quite some time about trying to develop either a project or a course with their designers on looking at how we can design spaces that flow a little bit better and create a sense of calm and safety than your average putting concrete pillars out by the curb and a bunch of different, fluorescent lights and cameras and things like that, and thinking that that's good enough. I want to really go deep into it with, finding out color schemes and sense of smells and sound dampenings and all those types of things, and really exploring that space to develop maybe not new building codes, but certainly different standards and recommendations for schools, office buildings, things like that, where if all that is needed is to put, paint the hallways a different shade of green, and that brings down anxiety X percentage points, maybe that's enough to help with truancy. People feel more open to speaking about their issues, or feel a sense that it's a much more calmer space than it might be. So those are the types of things I'm really, really interested in. Trying to gather up as much information as I can about that kind of stuff. And most of that looks into sort of the commercial sector. And the commercial sector is really big into that kind of stuff. And I actually have a huge section in one of my trainings around understanding how those different things can motivate behavior, and things like that. So those are that's the one thing that kind of is the thing that's always in the back of my mind that I'm interested in hearing about.
Yeah, thanks for sharing that. That is very intriguing, and I look forward to learning more about that in the future.
Yeah.
Number 4, professionally, do you recommend anything? A book, podcast, anything?
Professionally, there are a bunch of behavioral threat assessment and management strategies out there. And so again, this is going to be based upon your unique situation of where you sit in how your business or how your school or your hospital or your organization operates. But there's no dearth of information that you can't find online about behavioral threat assessment. If anybody is interested in, wanting to know more about behavioral threat assessment, or which package is best for them, or if they need my assistance in, trying to figure out what's the best plan, getting training, that's something that they can just contact me through the website on. Nothing specific that I would say out there right now, other than sort of like your large research projects and things like that from various different government agencies around behavioral threat assessment, and targeted violence.
And then 5, last but not least, if there was one piece of advice you'd give to your younger self, what would that be?
I don't know if my younger self would even listen to myself now, but it's going to be just fine, is probably what I would just say. Like at a certain point, you have to trust that your talents and that your personality and your skill set is going to find a home, and is going to find a place where you're going to be valued, and your success is going to blossom because of that. Not always clear where that comes from, not always exactly when you want it to happen, but everything's going to be just fine.
Well, I appreciate that, Robert, and I appreciate all the wealth of knowledge that you shared today. It has been a learning and appreciative conversation for myself. So thank you.
Well, thank you so much. I really appreciate, taking the time to be on the platform, be on the pod. Hopefully, like I said, if anybody wants to follow up, they can check out the YouTube page, TVTP Solutions, and then obviously our website, tvtpsolutions.com. And there's a way to contact me through that as well. But thank you so much.
Yeah, truly is my pleasure. I'll be sure to leave those in the show notes as well as in the description below. Housekeeping items for everyone. Thank you all so much for watching. Be sure to subscribe, leave a like, leave a 5-star review, and share this with a friend who'd get some value with it. See you all next week. Peace, everyone.